I hope you're ready to move around a little bit today, because this is about action. This is about the actions, the movements that joints take. So we're going to be doing some actions here, but let's talk a little bit about what we're dealing with here. I'm basically teaching you vocabulary today, right, that describe these specific joint movements, okay? And they're very much related to the planes that we learned, right? Because really we have three different planes of motion, right? Remember this frontal plane that divides me into front and back, or anterior and posterior. The sagittal plane that cuts me into left and right. And what's the last one? Transverse plane that cuts me into top and bottom, right? So our multi-axial joints can move in all three of those planes. And each of those motions have a different name, right? And the other joints may only move in two or even in one. And again, specific names for those specific movements, okay? Those of you who are going to go into the medical practice, you will use these every day, okay? Those of you who don't, at least it's a way that you are having a knowledge when they're talking about what we mean by flexion or extension or abduction, because you'll hear these words. These are fairly common words to describe motion. I have never in my entire life heard of zero position. I've heard of anatomical position, okay? But this zero, okay, whatever, that's fine if you want to call it that. It's this, right? Standing upright, palms forward, that's a key piece, right? Palms forward, because you're in supination, not in pronation of your wrist, which we'll talk about those words in a second. Okay, number one is flexion and extension. So stand up. We're going to move. We're going to move today. Okay, take off my jacket, because we're going to get moving here. All right, we're ready to go. All right, you ready? So, flexion, and again, I am not interested, you don't have to know, you don't have to memorize the definitions for these motions, okay? But what I will do is give you a picture of somebody doing this and ask, what is this motion? Does that make sense? So I'm not going to ask you, which is the motion where the movement decreases the joint angle? I'm not going to ask that. That's more complicated than I want, because it depends on the joint which way that is, okay? So flexion, let's go flexion of the shoulder to begin with, okay? Flexion of the shoulder is this motion. I'm coming up like it's a field goal, it's good, right? Okay, I'm directing the plane in this way, does that make sense? What plane is that in? This is frontal. Sagittal plane, it's in the sagittal plane, right? I'm going this way, okay? So this is flexion, and this would be, the opposite would be extension. All of these movements come in pairs. Shh. All of them come in pairs. There's only two that don't. That's rotation and circumduction. But otherwise, all of these motions are paired. They're opposites, right? So flexion is this way. Extension is that way. Of your elbow, what's flexion? This. And this is extension. Of my hip, this is flexion. Go ahead, yeah, move with me. Much better if you're moving. Okay, we'll see if you can stand. Oh, yeah, don't blind me. Okay, flexion, and then extension would be this way. Okay, again, I'm showing you here, this way is extension. Again, remember, this is sagittal plane, right? So imagine cutting me into left and right. That's my plane. My limb is trapped in that plane. Okay? Of my knee, what's flexion? Bending backward, heel toward buttock. That's flexion. Extension is straightening. I hear you. That's why I'm saying don't get too caught up in the definitions. Okay? Extension is straight. Flexion is bent. Yep. Your elbow is an extension. Yes. Your shoulder should be at neutral, at that zero position. But yeah, it's in neutral. Okay? I won't say foot because foot has its own names for its flexion extension. We'll talk about that in a second. Okay? So again, here's some flexion. Again, your textbook has a lot of good pictures in these, right? So I encourage you, check out your textbook. Lots of good explanations and pictures about what's what. This hyperextension thing, we don't really use that too much for your shoulder. Your knee, we can do some hyperextension where we're going too far back. Have you seen some of these ladies that will have very thin legs that they can like hyperextend their knee, almost bows backward? Okay, yeah, that's the way they work. It's fine. Guys can, but I see it more often than ladies. Yeah. Okay, next motion is abduction and adduction. Now, in order to keep this from being confusing, we will call it a abduction or a deduction because they sound so similar, right? To abduct, like to take something away, right? I'm moving my arms away from my body. I'm abducting a child, right? I'm taking them away. Abducting, coming away, and then I'm adding my arms back to my body. That would be adduction. Add. Okay? What plane? What plane is this, guys? This is frontal plane. Sagittal was flexion and extension, right? Frontal plane is ab and adduction. Okay? Very straightforward. How about for your hip? What do you think is abduction of your hip? Going away this way and coming back is adduction, adduction. Abduction, adduction. Again, think of a jumping jack. Going out is ab, coming in is ad. Next one, elevation, depression of your shoulders. This is the easiest one. This is where we use this motion. We're still in that frontal plane, right? But this is, I'm elevating, I'm lifting. That's elevation. And I'm depressed. And my shoulders come down, right? Elevation, depression. Sir? It's actually, you should keep your shoulders in a bit of a depressed position. You're correct. It's kind of this rotated back position. This is where we should be, right here. But oftentimes it kind of gets rounded forward. That's more depression. It is a frontal plane movement, so it's moving down further. Like I can push down like this and up. Does that make sense? It doesn't do much that. It's a little bit. Here's our next one. We've got protraction and retraction. So this is horizontal plane motion. So shoulders are really the only place we do this motion in. Protraction, if I'm just in like a neutral position, right? And I bring my arm up a little bit into flexion. Okay? And I am pushing forward. Don't lean your whole body, but just from your shoulder, you should be able to push your arm outward. Okay? Again, don't lean your whole body. Don't turn. Everything else stays still. You're just pushing forward. And then retraction is backward. Okay? Think about a lat machine. Those guys have been in the gym, right? If I'm pulling like this, right? This is shoulder retraction. Posterior movement of my shoulder. Okay? Whereas this, punching outward, that is protraction. Retraction, protraction. Retraction, protraction. Does that make sense? Pops and clicks you hear as you're doing that? Yeah, I need to be doing more. Okay? Circumduction. This is one that you won't hear much about, to be frankly honest with you. It's a motion that stay with me, guys. This is a motion that's kind of a combination of a number of different things. But the point of it is that one end stays stationary and the other makes a circular motion. So you can do this with arms like this, right? You can do this with legs like that. There's really no real reason for us to do that in a significant...
Why did we do that in E-class?
Well, it's just you're getting your shoulders warmed up, that's all. You're working abduction.
Does it matter which way it rotates?
No. No. But like I said, for the most part, this is not a motion we use a ton. Okay? This one is one we do use a lot. Rotation. Rotation. And I said this doesn't have a pair, but actually rotation does. I only put rotation on this. You don't have to worry about which way is which. But let's take our shoulder, for example. So it's easiest to see if we make our shoulders in just neutral and our elbows a little bit of flexion. Okay, we call this a 90-degree angle, right? Like this. Okay, if I take and turn my arms outward, notice my elbows stay attached here, right? I don't do this. Okay, from here, turning outward, that is external rotation. If I do this, that's internal rotation. External, internal. You're supposed to have almost 180 degrees of this motion. Okay? You can do the same thing if you put your shoulder into a little bit of abduction, right? And still that elbows at flexion, about 90 degrees, right? You are now at full external rotation, and this is internal rotation. External, internal. Are you comfortable? Internal rotation is that motion to I put my bra in the back, right? This is that motion. Okay? If I'm scratching the back of my head, shh, this is external rotation. Are you with me? Yep. Again, my shoulders are in that. This, because right, I'm in this position. I'm just telling you, I'm just moving into more abduction. Okay? Are you with me, friends? So again, that's all shoulder rotation. All that's the same motion, but it looks different depending on where you put your arms. Does that make sense? You can do rotation with your hips as well. It's a little bit tougher, I'll be honest with you. If you hold on to something here, okay, and your knee is in flexion, 90 degrees of flexion, and I can turn, I'm trying to get so you can see, I can turn my hip outward and inward. Outward and inward. Now, what's funny is, you think this is external rotation, right? Oh. It's not. It's internal. Because it's the femur that's turning inward. That's turning my leg outward, right? When I turn my femur outward, like I'm crossing my leg, that is external rotation. But my foot goes inward. It's weird. Notice on the picture, they didn't even give you that. They just gave you the shoulder. Are we good? You hurting yourself there? Okay, good. All right, supination and pronation happens in only two places, in the wrist and in the foot. Shh. Wrist and foot. So, this motion in anatomical position, right? Let's bend our elbows into 90 degrees of flexion just because it's easier to see. This is supination, okay? My hands are up like, I need some soup, please. Give me some more soup, please. Right? Supination. Pronation is going the opposite. What bone is rotating for us to do this? The radius. Okay? The radius is rotating on the ulna for us to do this. Okay? There is a pronation and supination of your foot, but we call it different words, so we'll come back to that later. Okay, pronation, supination. Okay, on your list, on your sheet, there's only two others that I want you to know. So these special movements, you don't have to know. I want to go through them with you so you can see them. Okay? So, we'll start with the head and the trunk. Okay? So, if I'm bending forward like this, though this can be hip flexion. Like if I keep my back straight, if I keep my back straight, this is just hip motion. You can see how tight my hamstrings are because like this is as far as I can go. Okay? But again, that's with my back totally straight. If I let my trunk bend forward, okay, that is flexion of my trunk. Extension of my trunk going backwards. Extension going backwards. This motion like this, if I'm running the outside of my fingers down the sides of my legs, that is side bending, or they call it lateral flexion. You'll hear it called both of those. Left lateral flexion, right lateral flexion. You say, no, that's left, Mr. Hess. No, it's my right, my left. Of the head, if I'm doing rotation of my neck, is this. Remember that some of that rotation comes from the axio-atlantis joint, right? That you got it's about 30 degrees of rotation both ways that comes simply from that joint, C1 moving on C2. The rest of that motion, you should have about 90 degrees. The rest of that comes from your spine actually rotating. The rest of your spine. Sure, yeah, sir. Shh. They rotate. Mm-hmm. Yeah, they do. You can also do lateral flexion. Lateral flexion of your neck. My neck is very tight today. So this, like your ear to your shoulder. This is right lateral flexion of the neck. Left lateral flexion. Your mandible. This mandible does some cool motions, right? You all know about normal just chewing, but your mandible can go different ways. Can you move it to the left? Or I'll go right for you. Can you go move it to the right? And then move it to the left? Move it left, all right, left, all right, left, all right. All right, that's pretty cool. You can also protract, stick out, like you're British, right? You got this big overbite. And then pull it back in, right? You retract it, pull it in. It's tough to do. Doesn't have as much motion. Protraction's easier. Okay? And then what we call chewing, open is depression, closed is elevation. It does. The maxilla stays still, yes. Now, you can add head motion, but no, the maxilla stays still, the mandible is what moves. Yep. Ooh, that kind of hurt my jaw a little bit. So I'm exaggerating. Okay, special movements of the hand. So, you've got your hands like, well, okay, we'll put them upward so you can see it. Probably easier. Okay? If I bring my pinky toward my ulna, that is ulnar deviation or ulnar flexion. If I take my thumb toward my radius, that would be radial flexion or radial deviation. Notice you've got way more ulnar deviation than you do radial deviation. It's because of the bones in your wrist, how they're set up, that allows more of this motion, the ulnar, and less of the radial. Your fingers, if I spread them apart, what do you think that's called? Abduction. Abduction. Jazz, right? Abduction, though that's not really because we're just in abduction. Okay? And then we're bringing them together is adduction. If I bend my fingers like this, what do you think? What motion is this? Flexion. This is flexion. This is extension. Flexion, extension.
What if you like bending it back, like some people?
There would be hyperextension. Yeah. I'm totally with you. Yeah, that would be hyperflexion. Yep. Yes. Shh. No, double jointed means you would have more motion than normal. So you would actually have extra motion than you or I normally would. No, it'd be, I think, easier, unless you're good and strong. Yeah. Shh. Stay with me, guys. The thumb's got a lot of crazy motions. Okay? And again, I'm not necessarily interested that you know all of these, but I'm just popping them into your brain here. Okay? Palmar abduction is moving the thumb away from the hand, okay, and pointing it anteriorly, right? So I'm moving it anterior away. So like this.
Oh, what?
It's weird. Again, go anatomical position, right? Anterior's that way, right? So move your thumb that way. That's like this. Yeah, like I'm doing this. I'm showing you this is the motion. It's not a motion we do on its own very often. Okay? And of course, are you comfortable? Adduction would be radial adduction, moving the thumb away from your index finger. So this motion. right? Different plane, right? So if I look at it like this, it's like going a thumbs up, right? That is radial abduction. Flexion is the tip of your thumb toward the palm, so it would be like this, right? This motion. I'm just bending my thumb down and flexing it, right? Extension would be straightening it. Opposition means thumb going toward a finger. This motion is opposition. I'm opposing two things together, right? And reposition is moving it back to the middle. So opposition, reposition. Opposition, reposition. Okay, last one that's on your list. No, sorry, two more on your list. The first is dorsiflexion. So you got to use your foot so you can see it. I'll put my foot up here so you can see it. Dorsiflexion is this way. Toes coming toward your tibia. Dorsiflexion is toes toward tibia. Plantar flexion is toes away from your tibia. Remember, the bottom of your foot is called the plantar surface. So it's plantar flexion. It's moving the bottom surface downward. Okay? So dorsiflexion is coming off of the gas. Plantar flexion is pushing on the gas or the brake. And last but not least, inversion is your ankle rolling this way. So foot, bottom of your foot, plantar surface facing medial. And eversion is the foot rolling outward. So plantar surface facing outward. Most of your ankle sprains are inversion sprains. You twist your ankle like this. Can you tell how that I have really no ligaments left on the outside of my ankle? That does not hurt at all. And that's my foot. That's not my shoe. Yeah. When I was in PT school and we were actually learning, because we actually manipulate these joints, we move them in certain ways, my partner was like to our teacher, I can't feel this ligament, because you can actually feel where the ligament stops the motion. And my teacher came over, she's like, oh, that's because he doesn't have any. I've twisted my ankle so many times that it's going, right? Yeah, yeah. It doesn't hurt, right? Yeah. Sometimes I'm just walking along and I'll miss a step or something and boom, my ankle will give out. Oh, okay, yeah, I'm good. Shake it off. Keep walking. Are you with me, friends? Shh. There is supination or pronation of the foot, but it's very complex. The motions are. If you have a super flat foot, that is really pronation. If you have a super high arch, that is supination. If you can imagine those two pieces. Again, I'm not testing you over that. And again, if you're a physical therapist, this is your world. We deal with these motions all the time. In our notes, you would write these 1,000 times a day because you are going through talking about what motions you're doing. All right? Any questions here? This would be a very strange lecture to listen to online, in my opinion. Any questions with those motions? Again, all I'm wanting you to know from that list is, can you identify the motion? If I give you pictures like these, right? Or just a picture of a person doing some motion. It doesn't have to be these exact pictures, right? That's what I want you. You will identify this motion as abduction. This motion, kicking out, as extension. Does that make sense? Cool.